Welcome you to mediaforpillar.com, sir. I'm Taruni Gandhi. Kindly introduce yourself.
Uh, Thank you, Taruni. Good evening. I am Dr. Arun Bansal. I am Professor of Pediatrics at PGI Chandigarh.
Okay.
Yes.
Sir, in this COVID crisis, many people have, already assumed that rest of the diseases has, already taken a seat back. Okay. Back seat of coronavirus doesn't mean that it is, rest of the diseases are not existing. It is very much existing. So the parents of young children are quite worrying. काफी चिंता हो रही है उन्हें कि अगर हमारे बच्चे को कुछ हो जाता है, मान लीजिए काफी गर्मी के दिन चल रहे हैं, नक्सीर फूट जाती है बच्चों की, काफी बच्चों में ये दिक्कत आती है, तो पेरेंट्स ब्लड निकलता देखते घबरा जाते हैं कि अब क्या करें। ऐसे कई सारे सवाल हमारे से कई पेरेंट्स ने पूछे हैं। Many parents have sent me so many questions. I have shared with you also.
हाँ
To
जी.
start with that,
Yes.
there is a mother called नीति विवेक दावर. उन्होंने कहा है कि उनका बच्चे का जन्म 2019 में पीजीआई में ही हुआ है और 9 महीने हो गए हैं बच्चे को, नेक्स्ट वैक्सीनेशन पेंडिंग है। तो क्या वो हॉस्पिटल में आए इसको करवाने या किसी से भी करवा सकते हैं?
Uh, See, that's a vaccination has been a major concern during this COVID epidemic because it has these services have stopped. But I would say that delay of a month or two of some vaccines has no impact on the child. We can easily wait for some time.
Okay.
Moreover, the local PHCs and dispensaries have opened up.
Okay.
We would advise rather than coming to PGI, they can go to their local doctors. They have also started private practitioners and local government dispensaries have also opened up for vaccination. They can take an appointment and go there and get it done after taking due precautions. It is better not to concentrate or crowd at one hospital, rather scatter and go to different places wherever which is nearest to you.
Okay, so there is always a have been a, this must have been a question before you also कि हम अपने बच्चे की इम्यूनिटी कैसे बढ़ाएं, हमारे बच्चा बार बार बीमार हो रहा है, कैसे बढ़ाएं उनकी इम्यूनिटी। तो मार्केट में बड़े इम्यूनिटी बूस्टर्स भी आ रहे हैं, कुछ कैसे पाउडर्स आ रहे हैं सर, क्या ये पाउडर वाकई ही इम्यूनिटी बढ़ाते हैं?
See, this thing has immunity word has picked up a lot during COVID times. Earlier, also people used to ask, but now definitely this has people have become more cautious. Ki if we increase the immunity, we will not go sick or we will not get this infection, especially coronavirus. First of all, obviously, good immunity makes people. If you have a good health, good immunity, you have less chances of getting any kind of disease, not only COVID, but any disease, any bacterial or viral infections. And even if you have contracted that illness, you can have a good chance, your body has a good chance of fighting it out. So the chances of recovery are high if your health is good and immunity is good. Now the question comes that whether anything can be done to improve immunity with supplements or any immunity boosters or this market में जो supplements चल रहे हैं.
जी.
No need, no need. It's only the good diet, good healthy lifestyle, and good healthy diet is what is going to make a difference, and nothing else. Nothing else like immunonutrition powders and all those things which come in the market has no role at all.
Sir, when there is a kind of an emergency for a child to run towards a hospital, for example, if a child has a टैक्सीपेट जिसे हम वो नक्सीर फूटना भी कहते हैं, मैं उसी सवाल पे आपके पास दोबारा आ रही हूँ। बच्चे के बहुत ज्यादा खून बह गया है, 1 घंटे से लगातार खून बहता ही जा रहा है, तो क्या पेरेंट्स को हॉस्पिटल भागना चाहिए या घर पे ही किसी तरीके से मैनेज करना चाहिए?
नहीं, obviously 1 घंटा is too long a time. Usually it does not last for long. अगर नक्सीर है, epistaxis doesn't last for such a long period of time. Ideally, अगर if it starts, first of all, they should try to pinch the nose and put the head down. Like try to touch your chin towards the chest and bring the head down and press the nose and do a cold compress or a cold wash of the head with cold water. So usually it stops with that, and that is the commonest way at home if anybody can do. Even
Okay.
if it still continues, one should contact. 1 hour is too long a time. Definitely, they should consult the immediate medical facility.
Okay. And usually it's a summer season, and children go dehydrate while playing, while doing any kind of overactivity. So many mothers have asked me what to do if child started vomiting all of a sudden. He is having all of a sudden cramps in the stomach and develops a fever as well. And the major question which is occurring, and parents are asking to me, is sore throat or a normal nose running and a normal fever considered to be as a corona patient, or they should run to hospital for this or not, or they shall take only a paracetamol and sit back?
First question about dehydration. I would say
Yes.
prevention is always better than treatment. So they
Yes,
should
sir.
try to have a good hydration. You know, summers are there. If child is playing outside, why not keep him hydrated beforehand? They should take care of it. Good water intake, good hydration, good food, healthy habits, and then they should go out and then also drink in between. They should be under supervision. But
Okay.
still, if one gets in, then they should try to make him comfortable, bring him in the house, and give some sips of water, maybe plain water or glucose water. And if he is persistent vomit, give small sips. Don't drink in gulps. So
Okay.
because that also increases the chances of vomiting. But
Okay.
if the vomits are persisting, then consult. No home medication.
No home medication.
Yes.
Okay, fine. And there are sort of questions by the mothers that many of mothers are facing, that their children having a nose allergy. They
Mhm.
must be waking up with the nose allergy, or the sleeping up with the nose allergy, snoring is there, and they are having a kind of a chest congestion altogether with this nose allergy. So what is the suggestion to those mothers who are suffering it day out and day in?
Yeah, this question, and I think I left one in previous part also, that if they have a cough, cold, and whether we should consider it as a COVID symptoms or not.
Yeah.
Coming to that question, that if a
Yes, sir.
child is having a simple cough or cold or running nose, that doesn't mean that because that is normal flu-like illness or a viral illness. That doesn't mean it is COVID. So
Okay.
don't panic. COVID is like you have to have some contact and then fever and other symptoms, loss of taste, cough, cold, and all these things have to be there. If the fever is persisting or high grade fever is there along with cough and cold, one should take immediate consultation. But if it is like, your child, if he had been having that symptoms prior to this episode also, you will know it is similar or it's a different kind of cough cold. So you
Okay.
can easily make out.
Okay.
So not every cough cold is COVID. So that is the message.
Okay.
And
And
now coming to this, like the second question about the allergy and stuffy nose and at night when they wake up, again, this is not like a new symptom, most likely not a new. Most of these parents might be feeling it since long. They might have
yeah.
experienced previous episodes also. So
Yes.
try to do whatever means. First of all, we need to find out what is causing the allergy, and that
Okay.
the parents are the best judge to tell us that what is the symptom, and recurrent episodes will make the parents better
Okay.
guide. They can tell, okay, ये खाया था या ये पिया था या उससे हो गया, ये product से हो गया, some cosmetic से हो गया. So that's
जी.
an allergic product. So the
Okay.
only, because no, usually these tests are not very easy or reliable to be done. So this
Okay.
history, previous history is more important in these cases. And then
Okay.
in that case, parents' role becomes very important. Mothers are very good judge of correlating कि इससे पहले भी हुआ था, अब इससे second time या third time भी हो गया. So that is, and then we try to avoid that. So
Okay.
whatever is the allergen, try to avoid it. That's
Okay.
the best way. Otherwise, then we have to be on medication if it doesn't improve or get examined.
Sir, in this, we are so much, the whole globe is so much, trapped in this coronavirus.
Mhm.
Everybody is quite so scared going to the hospital, and so
Yes,
shall the doctors. Even they are saying, don't come to us, even it is not an emergency.
emergency,
So,
yes.
so when is that an emergency, a panic button? when a parent should know, okay, now I cannot stop myself. I have to run to hospital.
So
What are
yes,
those
that's a
symptoms?
important question. There are certain what we call as red flag signs actually. So like the child is having high grade fever, fever not coming down, persistent vomiting, persistent diarrhea, not able to eat or drink, becoming lethargy, having seizures, turning blue, altered
Okay.
means and not responding properly, abnormal behavior, or any bleeding from some side. So these are some of the features which suggest that abnormal fits of body movement, sudden onset. So anything
Okay.
which is sudden and is persistent and is uh, prolonged. So one should be coming immediately. These are the red flag signs or the emergent signs. They should come in.
So PGI has given some numbers, some phone numbers to the patient. They have
Yes.
broadcasted also. So Advanced Pediatric Center also have given the numbers. Could you please
Yes.
tell us what is that number all about?
See, that is for your teleconsultation and tele-appointment. So you can, it's there on the website also on the
Yeah.
pgimer.edu.in. Different
Okay.
departments number are there, but the pediatric center is 275-5994. So I repeat,
275. Yeah.
275-5994.
Okay. 275-5994.
Yes.
Okay. So a patient or a attendant has to call on that number, get themselves registered, and the concerned doctor would contact them back.
Yes, yes. And or they will be given a slot or appointment key. This is the time you can call us again.
Okay. So any kind of a suggestion do you want to give to the parents that in this crisis, how
Yes.
can they take care of their child very well without going to the hospital?
See, I always say no amount of government administration or health infrastructure can take care of this COVID issue unless we are self-disciplined.
Okay.
So, no, in the world, no government in the world is capable enough to handle this epidemic till we become self-reliant or self-disciplined. So
Okay.
don't blame if we are behaving very in not in appropriate manner or not taking precautions and then coming to the hospital and saying that we are not being taken being care of. Obviously, we will be taken, but then if we will load the system, how will the administration take care of that? So take self-discipline is very important. So self-discipline means social distancing, wearing mask, hand hygiene, using hand rubs. Don't going out unless it is very important. So don't move out. I have seen people going out just like for anything for fun. Obviously, we have been under lockdown since last 2 months, 3 months. It's not easy to sit down, even for, especially for these small babies, small children. It's easy.
Yes.
It's not easy to in a small houses in congested places to keep them tied in the rooms. But then we have to because this is for our own benefit, not for anybody else.
One very small question. This is something
Yes.
out of context. I really need to ask you so that I
Hanji,
may,
Hanji. Yes.
tell the administration about it. Do
Hanji.
you really suggest that school shall open?
Uh, it's a difficult question, but I think schools can wait. Online classes can move on. And maybe
Okay.
only those which are very essential classes, like the board classes, maybe they can open and that too in a staggered way, they can open up and try to do something, especially if there are lab works and all to be done. If there are only theory classes, that can be done online. I don't think there should be any issues with that. Because again, if one child becomes positive in the school and he can infect so many, it is not a right thing. We will be advising.
Okay. Thank you, sir. Thank you for talking to
Thank you.
us.
Thank you so much.